Hello, I'm Dr. Meyer. This week I'd like to talk to you about pain. Pain is a very common symptom that drives people to see a doctor. It can be caused by anything from migraine to myalgia, arthritis, the back pain, and so on. Pain works by sensation of an injured part. So if you step on a nail, fibers go up into the brain to tell you step on the nail and get off of it. Or on a hot surface, and that's very important that you take protective action then. As one loses their sensation, then we have serious injuries, and this happens in diabetes and aging and so on. If the pain is usually brief and lasts just for a month or two, then we call it acute pain. And we treat this with over-the-counter medications, and we usually see improvement within the first 72 hours, and within a few weeks it should be pretty well over with. Now, if it lasts for longer than 3 months, we can call it chronic pain. Pain that persists for more than 3 months. You may need medical attention, and the usual over-the-counter medications may not be sufficient. And that's when people go and see a physician. So you start with over-the-counter medications, and then there's a number of things you can do to help relieve pain. One can walk. By walking around, you can actually relieve the pain frequently and handle it with the usual over-the-counter medications or stretch exercises and little physical therapy that you give to yourself. The other way to relieve your pain would be through distraction. We may think that this is a bad thing to be distracted when we're trying to do work, but we can distract ourselves with watching somebody do things, watching your children play, reading, and by getting your mind onto something else, then the pain is under control. There are several diets that people have used for relieving pain, such as migraine. Sometimes migraine is related to allergy-type sinus pain. And that's the reason many times people eliminate cheese and mold-containing foods, and their migraine gets better, but also their sinus condition gets better. One way to monitor the pain is to track it. Write down what kind of pain it is, where it is. Many times people come to the doctor and they have a hard time describing it, and they say, I have pain all over. That really means nothing, and that doesn't help your doctor to localize the pain or help you out with any modalities to relieve it. So sometimes just writing down, is it sharp pain, is it a knife-like, or is it just an ache, is it a burning pain? And that helps the doctor and also you to figure out what's going on. So you keep that in a journal and have it available, and you can work from that just like you do your diets. If you have migraine or allergic headaches, keeping a diet, and you can see which days, which foods are causing your headaches to occur worse. Frequently, if it's mold-containing foods, it's also mold-containing beverages, such as beer and cider and mold-containing beverages that will cause you the same type of pain. The other thing that we can do is strength training. Sometimes when we work out and build our muscles up, that gets our mind off of the pain, and it also helps get our body in shape, and so the strength improving exercises and stretch exercises. That gets into yoga sometimes, and but that is very good. People with back pain, sometimes just going through the 6 motions that the back can do relieves a lot of the pain. Some people use herb supplements. I had a patient the other day. She took some sort of an herb, and all at once her headaches went away. This pain went away, and so people can try these out before they go to the doctor. If this doesn't help, then we may have to go to occupational or physical therapy, where we have an expert work on the pain areas and see what helps them. This is very true for back and joint pains. And then there is neurophysiological treatment. This is very common now. In our HMO, we have a plan where the patients can go and sign up for neurophysiological, biological type of feedback, and the experience with these has been very good. They have shown that up to 90% of pain can be controlled through this mechanism without any medications. This kind of backfires when you tell patients this, because they say, well, you don't think my pain is real, I can just go and talk about it. And that's not the case. These are very real ways to alleviate pain. And that's it for today. Don't forget to subscribe to my channel for new videos and post any questions you have in the comments section below. I'm Dr. Meyer. Until next time, take care.